Well, trying to find hope when it feels like everything is going wrong. This has been one of those years. And this morning, we are highlighting a partnership to help make our community safer. We've got Justin Chase with us this morning from Crisis Response Network. Good morning to you. Thank you for being here. We
Good morning.
appreciate it. We want to get right into this because we know mental health is a top issue when it comes to moments that are tense with our members of law enforcement. And you are teaming up with Phoenix PD to try to help facilitate better situations when they do become tense. Can you talk about that?
Yeah, so the whole goal of the partnership that we have is to get the right professional to the right call and ensure that we're improving access to mental health care for individuals experiencing a crisis, and then increase public safety by reducing the rate that law enforcement have to interact with mental health related calls that really could be handled by a mental health professional. So the partnership, we're co-locating a crisis specialist from the Crisis Response Network hotline and embedding them within the 911 dispatch center.
It's just so great that we have this resource here in the Valley. I was reading that you have a warm line where people are, if they're feeling like they're under duress or having a lot of stress, they can call that. And we can talk more about that, or I'll post it on my Facebook page. But if someone were to call 911, you have and your team has the expertise to know whether or not this is a situation that could become even more escalated when police get involved.
Correct. There's, oftentimes the element of bringing an officer to a scene with somebody who's in distress can sometimes elevate and escalate the situation. So being able to have somebody come focused on engaging the individual, being able to put the time in to sit and talk to them to identify what's going on and troubleshoot solutions. So being able for us to dispatch mobile crisis teams with community providers that go out right on scene and work with them, or if we can resolve it on the phone. 911 dispatches are the opportunities there for our staff are a little more equipped to be able to spend as much time as we need to on the call. And that really helps on the public safety side, getting the dispatchers and the law enforcement agent officers back out into the community, supporting public safety efforts.
Let's talk about the officers, though, because we know a lot of members of our law enforcement are not trained when it comes to mental health issues. They're trained in a lot of other areas. But are you helping with that as well to help recognize what might actually be happening? Because so often it's hard to know what's happening.
Phoenix Police Department's been a very progressive agency, the law enforcement space, when it comes to engaging individuals with mental health challenges. So we partner with a number of other agencies throughout the Valley to help train officers through a program called CIT, Crisis Intervention Team Training. That is a robust training mechanism. We have a large percentage of officers that have this specialized training. But again, with the resources short throughout various jurisdictions, we see across the nation, being able to help collaborate between mental health agencies, substance use related agencies, and law enforcement partnerships really help create a wraparound support system to minimize the risk and adverse impact
and save lives, right?
Absolutely.
Our Justin
Absolutely.
Chase, thank you so much for being with us. Crisis Response Network. It's great to know we have this resource right here in the Valley of the Sun. Justin?